Hello, everyone. Welcome back to the next AskDrKurt podcast. Today, we're going to be talking about anxiety, or GABA. Everyone has heard of anxiety. Not many people, or a lot of people, I would say the majority of people watching this podcast have probably heard of GABA at least. Maybe saw it at a health food store, maybe actually bought the supplement itself, or supplements similar. But GABA is a neurotransmitter, and neurotransmitters are chemical messengers in your brain and your body. GABA is interesting. It's the only one that's calming. It's the only thing that calms the brain and the body in the neurotransmitter category. So it's very, very important, and it's probably the primary, call it physiologic reason for the anxiety and depression epidemic we have. This might be one of the most unspoken, not talked about topics that is of the utmost importance in society today. This is, I would say, maybe close to the number one thing people come in for, whether knowing or unknowing it at the time they come into the office. GABA deficiency, low GABA, inability to use GABA, huge problems. We're going to break it all down today. GABA, I would say it's probably a topic near and dear to my heart because it's something that out of necessity I had to learn how to manage with the clientele coming in. People are anxious. People are stressed. People are ramped up, and there's not a lot to do to calm. There's a lot of drugs, which we're going to talk about. We'll cover that next when we kind of break down some of the basic rules and physiology when it comes to GABA. But there's not a lot of stuff out there to really help people calm down and then ultimately begin to use the calm. So let's get started. So when it comes to physiology, there's a couple things we need to look at. GABA is the only way we can calm down. So a lot of people feel ramped up. We're going to cover the symptoms next. I think it'll just be easier if we get a little baseline stuff of physiology out of the way. But we have a major excitatory neurotransmitter, something that wakes you up, something that gets your brain driving, it gets your body going, glutamate. Glutamate is also, I think, in a toxic circumstance, glutamate is the neurotransmitter of seizures. So think too much glutamate in the brain, you can have a seizure. Well, there's only certain parts of your brain that cause body seizures if you have too much glutamate in the motor cortex. But there's a lot. Glutamate also can drive up anxiety. It can drive the brain too fast. One enzyme step away in that same pathway is GABA. There's an enzyme GAD, glutamic acid decarboxylase, and it is driven by nutrients, but that enzyme helps your body take glutamate and make GABA, which then GABA calms the glutamate response. So it makes sense when you think about this. For example, if you're a kid taking a test, well, you want the glutamate, wake up your brain, get the answers out on the test, and then once the test is over, you want to calm down. And it makes sense that the body makes that on the same pathway. Now, there's 3 nutrients needed to drive GAD, to drive glutamate to GABA: magnesium, taurine, and B6. So those are the 3 primary. So GABA essentially ends up being a nutrient deficiency in we'll cover some of the other reasons too. But in primary, people are stressed. They're ramping up all day long. They're ramping up with coffee, with screens, with lack of sleep, with worry about the government. I mean, people are stressed about everything. I think we're probably in the most stressful time in history without any real threats. So we're near the safest time in history, but yet some of the most stressed time in history, and a lot of it is all psychological stress, which ends up being more damaging in the long run. So now we kind of covered a couple things physiologically. Glutamate, our excitatory neurotransmitter, and our calming neurotransmitter are on the same pathway. They're one step apart. And the three things needed to drive that glutamate to GABA production is B6, taurine, and magnesium. Now, I'm sure some of you are thinking, taurine, doesn't that ramp you up? Where have I seen taurine before? Yes, you see it on energy drink cans. I think Monster specifically is one that it has it, prominently listed. Why do they have taurine in energy drinks? Well, the taurine's there so your heart doesn't explode. The taurine is there for the GABA effect, for the calming effect. Because otherwise, it's tons of caffeine and sugar, and it's ramping you up, and you're going without any calm. They have to replenish taurine. Some of you may know this as well. There's also a whole industry of food, animal food, that requires taurine to be added, and it's dog and cat food. They have to add taurine, otherwise the processing of it depletes the taurine and the animals start to have seizures over time. So taurine, indirectly or directly, a lot of you know, is very, very important. And it ends up being probably one of the main components of the GABA cycle. So let's jump into some symptoms, because that's a little bit more interesting than the physiological part. It's just the part we had to cover because it all starts to click and make sense the more we go through it. So of course, anxiety. Main symptom, feeling anxious, feeling panic for no reason, which I guess some of you would say is that low-grade anxiety you feel all day. This tension, inner tension, where you wake up and you're tense. This, we're going to cover some other symptoms to kind of degrees, but that jaw tension, the head tension, the muscle tension, that tension in general, just all over the body for no real reason, is a major component of low GABA deficiency. Overwhelmed, emotionally and physiologically, just being overwhelmed. Hard to turn off is a very classic one. Worrying about things that are of no consequence at night. Worrying about, your toenail where it kind of chipped off, and is that going to turn into cancer? That's not a rational thought. Many of you know it when you think about it. You're like, why am I even thinking about this? That's a sign of low GABA, because if you think of it physiologically, your glutamate's ramping you up. Now we're not getting that glutamate to convert over to GABA and calm down. It's just driving and going and going and going and going with no break. And that brings us to, that's what I like to equate GABA to. The best comparison is to think it is your brake. It slows your thought process down. It allows you to think about something and think, is this worth my time? Is this worth going through the motions? Do I need to worry about this? Do I even need to give this any thought whatsoever? An example would be oranges. You and your spouse, your wife goes to the store, she buys oranges. Or your husband, whoever is going shopping, they go to the store, they buy oranges. You come home, you're like, I don't even like oranges. Every time I eat them, I get a canker sore in my mouth. There's a couple routes you can go. A low GABA person might start a fight. Say, she never listens, or he or she never listens. Why are they doing this? The brain starts to go, that glutamate is rising and rising and starting to rile you up. If you don't have GABA, that break, think if you had a break to slow that thought down and say, what are these oranges, $3? Is it worth fighting with my spouse? Am I going to create a fight over some dumb oranges? Or am I just going to say, maybe the kids will eat them, or we'll give them to the neighbor? Or my mother-in-law's coming. She likes oranges. I'll give them to her. There's a lot of different things you can equate if you had a couple seconds to slow down and think. So GABA, think of that as your brake. It's slowing you down. Or if you don't have any GABA, that's going to turn into a full-blown fight. And then how do you finally slow down? Well, you slow down when you burn out a glutamate. So essentially, you're fighting until all of that glutamate is used up, and your brain and your body just get fatigued, and now you can finally settle the fight. But now we have all the aftermath. We got to deal with, we upset our wife or spouse. Now they're crying. Now we're fighting. Now you might be sleeping on the couch. All over oranges, where if you had enough GABA, you just would have said, not that big of a deal. Another example could be, kids and taking tests. If you're, quote unquote, not a test person because you get so anxious, you probably have a GABA problem. Because if we think of this, we need a little glutamate to get those answers. Well, if we don't have any GABA to slow our thoughts down, let us think about it, get us the right answer. What does glutamate do? It ramps up and up and up and up and up. So now we're all anxious and think that might be the first question out of 50. Now we can't slow down. We can't break and think. We can't calm a little to get the rest of those answers, and we end up failing the test. So those of you who know or have children who are very anxious, anxious test takers, or just anxious in general about everything, probably a GABA issue. All right, so we have some symptoms. So we can kind of also view this in terms of physiology, where allergies and lightheadedness, muscle tension, that might be a slight GABA issue. And if you think, yeah, we all probably feel that here and there a little bit, which would make sense. As stress goes up, we might become GABA depleted momentarily, for a few days, for a week. We all can become a little GABA depleted, and then we sleep, and then we eat foods with high magnesium. Maybe we take some magnesium and B6 and taurine, and we feel a little better, and we start to calm back down. Well, if we don't, we start getting a little lump in our throat when we eat. We start feeling that more than anxiety. We start feeling it in our chest. We can't breathe. We start getting dizzy. How many of you grind your teeth at night or wake up and your head is tense, your jaw is tense because we had no GABA while we were sleeping and we were tense all night long, or your hands hurt, which then turns into chronic pain. Because now if your body and muscles are ramping up and they're not calming down, because as we know, magnesium is used to calm the muscles after squeezing them. So if we're magnesium deficient, which can lead to GABA deficiency, our muscles are going to be sore. And eventually that body and soreness starts to go into the brain. Now we're feeling rage. We're not able to calm down. So that can be very angering when your head's ramping up all the time. So we got to calm the body back down. And then this turns into other issues, nerve issues, tinnitus in the head, dizziness, muscle pain, neuropathies, and eventually marijuana abuse, alcohol abuse, prescription drug abuse in the terms of opiates and Xanax and benzos. So we got a lot of things. So it starts with minor little things. Then we start feeling it in our body. Then we start feeling it in our head and our jaw. Then we start feeling it in our heart and our muscles, and eventually into our brain. And eventually it turns into drugs and alcohol. So let's get the right notes out. So now let's talk about alcohol, because this plays an important role. So when it comes to prescription drugs or drugs, the drug category versus the nutrient category, they do different things, but on the same pathway. So we have GABA releasing drugs, and I'm going to state this very simply. I'm not going to dive totally into all the physiology and mechanisms. There may be some things that are technically kind of right or kind of wrong, but in the general sense, we got to describe this in a way that makes sense and can clinically be useful, because sometimes all these clinical studies don't do much. They have all these intricate little things, but in terms of practicality, how do we help people off the street? How do we help people calm down and become less anxious? It doesn't help us at all. So when it comes to drugs and prescription drugs, they help you release GABA. The drugs are going to take whatever GABA you have and release it. So it can be very calming. That's partly why they're a little bit addicting. And I always ask people this when they come in and we have a GABA case. What are the only 2 drugs that can kill you if you are very addicted and go off of them cold turkey? GABA drugs, alcohol, and benzos. To my knowledge, I think they're really the only 2 that can kill you upon extreme withdrawal. And part of that is because your body's lazy. Your body does not want to try and work to calm down. Hence, why is meditation hard for most of us? Why is yoga boring? Why are all these calming activities boring? Our body doesn't want to try to release GABA. It wants to do it really easy. And you know what's really easy? A glass of wine, a beer, a shot. Alcohol releases the GABA real quickly. And I'm sure a lot of you can experience this or relate to this. When you get home and you have that first drink, now we can relax. That's GABA. That is GABA in the flesh. That's what it feels like. And after a while, your body says, why are we going to try to calm down? That alcohol is waiting for us. It's 15 minutes away. We'll just be anxious until then, because that alcohol is so much better at getting your body to release GABA than anything you could ever do. Same with benzos, same with Xanax, same with marijuana and chronic use. So we got to think, the body's lazy. Drugs release GABA, and they do it very, very well. But also, we get hooked on them. Our body stops releasing GABA on its own. So that's part of that addiction cascade that I think a lot of people tend to forget. And that's why the relapse rate, I think, is so high too. It's a big contributor to that is we got to help people physiologically with GABA. We can't just say, oh, stop drinking alcohol. Be sober now. What are you going to do? Your body's going to take a long time to recover, and it's probably deficient in all the nutrients needed to make GABA. So now we're just anxious. We've trained our body not to release GABA because of chronic drug use. And then we have no GABA because we can't replenish it. So remember, now the other side of that is nutrients replenish. You need nutrients to build up the GABA stores to help your body be able to make and store the GABA. So if you don't have those nutrients, of which the drugs will deplete those nutrients, we're going to have a big issue. So in some cases, we need both. Some people, we have to have the GABA drugs because their body's not good at releasing it, and we have to replenish at the same time. Some people, we don't need to have any drugs, and they just need to replenish. A lot of people, that's the case. And there's things like theanine, which can help release and help your body use GABA. So there are nutrients. It's just nutrients are never going to be as powerful as drugs. Drugs are drugs for a reason. They work, and they're really powerful. Marijuana also is in this category. So more chronic use of marijuana, which I think is a major issue in a large percentage of the population. I think a lot of people are doing marijuana every single day. And that's a problem. That's a GABA deficiency. That means if you can only relax and need that marijuana for anxiety purposes, for calming, for stress, to relax, to sleep, that's a GABA problem. And we need to get that addressed as well. So if there's more questions on that, we can get into it. But now we need to talk on what leads to a GABA problem. How does this come? Well, a main part of it is personality. We have anxious personalities. We have calm personalities. There's that genetic calming thing that is a big part of it. I'm not going to say it's all of it because it drives me nuts, as many of you know. 95% roughly, I think it's what the estimates are. 95% of life is not genetic. Of all of our health issues, of our demeanor, of all these things, 95% of it is your own issue. It's your environment. GABA, you do inherit, your immune system, the way it kind of reacts, your upbringing. If you have an anxious mother that taught you how to be anxious, you're probably going to be anxious. If you grew up in an abusive house, you're probably going to be anxious. There's a lot of stuff that goes into that life, nurture versus nature. We got a whole thing. So think there is a whole personality, life, upbringing, everything component to this. There's stress in general. Whether it's chronic stress will deplete GABA, and extreme acute stress will also deplete GABA. Even just minor acute stress depletes it a little, but a lot of times you will recover from that. Gluten, this kind of goes into our autoimmune category. Gluten will light up your brain, stimulate that glutamate to a high level. And if we don't get the gluten out, we can't fix the GABA problem. But we also have to fix the GABA problem when the gluten problem is there. So gluten, just remember, is a major trigger, of which we can go down the gluten rabbit hole at a different time. But if gluten's the issue, which we have tests for that, we will cover that. And then, of course, drug usage. That's the Xanax, alcohol, chronic marijuana use, or chronic alcohol use. So any drugs that stimulate GABA, remember, your body's lazy. We got to get those taken care of. So when it comes to just some other tidbits about GABA, every cell in your brain uses GABA. GABA is primarily made in your brain in the temporal lobe. So that's on the sides of the head. And it is the brake, which I've touched on. All right. Another thing we need to take care of is, some of the things that can lead to GABA deficiency that are a little outside of GABA are toxicity. If your body's toxic, if your liver's on overload, think if you're using the GABA-related drugs, that's going to burn out your detox system, which will stress you out. When it comes to GABA, a lot of times we have to also start incorporating these other stressors. Mental stress is going to deplete GABA. Liver detox stress, going to deplete GABA. Not sleeping, going to deplete GABA. Anemia, not having enough cellular energy, mitochondrial problems, going to deplete GABA. So we have to start, so this kind of turns into an overall body stress issue. Well, how do we fix this? This is, like I said before, this is one of the most common plans we have because anxiety is a massive, massive issue. And, you know, I'm all for talk therapy. I mean, I think we hear about it and it's inundated with mental health things everywhere. The one thing with mental health we're not taking care of is GABA. We need to start really focusing on what's the physiologic part of GABA, what's going on with GABA, how do we release GABA, how do we replenish GABA. We need to really start diving into this GABA category because it kind of seems to be conveniently not talked about. Everyone's anxious, but yet we never talk about GABA. I don't hear GABA commercials on TV. I don't hear GABA commercials on the radio where there's, I kind of did a search on GABA for podcasts. There's not a lot out there, which is very confusing because it seems to be the root of most of these issues. So how do we treat it here? Well, first, everyone that comes in, we chat. We go through your history. We go to why you're here. A lot of times we can figure it out. If we go back to the symptoms part of this category, of this podcast, we see that there's a ton of stuff. This almost fits everyone. So it's kind of not, do we have a GABA problem? It's just how much of a GABA problem do we have in most cases. But we break that all down. So we can get a pretty good idea from that. We also have a brain burnout form because as some of you know, neurotransmitters are hard to test for. There's a urine test out there, but then again, that's if your detox system is stressed, you're not going to be making the right metabolites and the right ratios. Also, where did they get the values for some of these? Some are high, some are low. Well, as we know, every single person is different. A calm person's not going to use as much GABA as an anxious person, even though the anxious person appears to be using less GABA. So neurotransmitters get kind of funky. They're used in the brain, and then we can test their metabolites, their detox, particles, but sometimes that's not very good. So we've come up with a subjective questionnaire that addresses brain burnout. So we're kind of looking at how do you want your brain to feel? Because GABA is partly your feeling and also a physiologic feeling. So that works pretty well. That was, kind of the original research was done by a guy named Eric Braverman. Interesting guy. He's had his challenges and things, but when it comes to brain research, some of his stuff is cutting edge and it's still cutting edge. And I think it's coming up on 20 years old. So we've kind of restructured that to make it fit for where we are at this part of the country, because different parts of the country, as you all know, are different. Here in the Northeast, we're in probably an anxious part of the country. So we kind of have it oriented towards that. So we have a questionnaire, which I find works wonderfully. And then of course we go through our full body comp analytics. Some people we see, if there's liver stress, we got to address that. If there's anemia or low iron, we have to address that. If there's gut and autoimmune issues, we have to address that. Because one of these things, which we'll figure out, is if the brain has autoimmune problems, it can make this GABA thing pretty difficult to work with. So I would say probably 8 in 10 cases we treat with our normal kind of GABA replenishment, our nutrient replenishment plan, and it works beautifully. And about 2 out of every 10, it ends up being kind of an autoimmune case, which then autoimmunity is treated completely different than nutrient deficiency. And then we have to address sleep, muscle mass, and all these different things. So once we kind of put that all together, the 3 main things we have to address are magnesium, taurine, and B6. And we got a great supplement cocktail. If anyone's interested, feel free to email my office or contact me from this, and we'll kind of send you over our info guide for it. But the key with GABA is we have to flood the system with as much GABA as we can. So a lot of times we're doing nutrients every hour for the first couple weeks because we have to calm the body and train it to calm with the nutrition versus the drugs. So once we start training the body to be calm, that's when we can start to incorporate lifestyle factors, which the classic example of this is how many of you out there hate meditation? You sit down, I can't meditate. This is dumb. What am I doing? Sitting here 3 minutes in and I can't. Well, if you don't have GABA, you can't meditate. So one of the things we have our GABA patients do over time is they start to meditate. And we have people get from 0 minutes to 30 minutes to an hour because they finally have GABA. They can feel it. They feel the calm from meditation. When you can feel the calm from meditation, you have GABA. So that's kind of one of our, at-home take-home tests to see, do you have GABA? Can you do calming yoga? Not a flow workout yoga, more of a restorative calm yoga, and feel the calm from it, not just be waiting and anxious the whole time to let it finally be over. Those are things to really fix GABA, or know you have and can release GABA. Then of course we have detox, toxins, different things. But at first is we got to fix those nutrient deficiencies, which we test for some of them, and then we tackle the program. So if this sounds like you, feel free to shoot me a message. We'll get you taken care of. We'll kind of start the process. But I will tell you, it's not a difficult thing. It's just a thing we seem to have forgotten about when it comes to mental health and Western medicine is we got to remember GABA, because GABA is your best friend. We'll see you next time.